Podcasting from eHealth New South Wales. This is Let's Talk eHealth.
Welcome to Let's Talk eHealth, where we showcase the projects and people of eHealth New South Wales. I'm Danielle Johnson, Delivery Manager for Cloud and Enterprise Infrastructure Services, and today my guest is Bri Gato, the Customer Engagement Manager at eHealth New South Wales. Today we're spotlighting our IT support staff. These teams provide help desk and phone support to New South Wales Health's 170,000 strong workforce, including our frontline clinicians. Bri runs a program that helps our IT support teams harness the power of feedback to drive improvements to their service. Welcome, Bri. Thank you so much for joining us today.
Thanks, Danny, for having me. I'm really looking forward to chatting with you today.
So, Bri, we're really interested to learn a bit more about your role here at eHealth. Can you tell us what a day in the life of a customer engagement manager looks like?
My role is really about being the conduit between my customers, like the Ministry of Health and eHealth. So I make sure that their voices are heard, that we're solving the right problems, and that we're continuously improving how we deliver services and value.
So, Bri, I'd love to learn more about that. Can you tell us what brought you to New South Wales Health?
So what brought me to health was the desire to be a part of something bigger. Knowing what I do behind the scenes for clinicians and making their life a little bit easier. That's what really drives me every day, helping the people who help people.
Excellent. And the support staff like our IT teams, as you know, are critical to enabling that smooth operation of our health system. But sometimes their contributions aren't always visible. Can you explain these teams' role and what an average day can look like for them?
Our eHealth technical teams really are the engine room. So they're often juggling high pressure, time sensitive incidents while really keeping the day-to-day running. So a single day might start with a system outage impacting a hospital or multiple hospitals. It may then move into resolving access issues and then end with someone needing urgent support just to send out a critical email. So all things really that could directly impact patient care. The people that are saving lives, they're not trained in IT. It really is our job to make sure that it's easier for them. And it's not always big events. So sometimes it's about just, giving advice, helping someone log a request properly, or even just explaining why something happened in human terms. They really, really are the problem solvers who genuinely care.
After a support request is completed, Bri, staff are asked to complete a short survey. Why is this kind of feedback important and what do you do with it?
So we started a program called the Customer Feedback Forum, and it really does just give a structure and visibility to feedback that we collect from staff right across New South Wales Health. Feedback really is important because it gives us that clear view of what our staff are experiencing right across the state, and it also allows us to really help the people who are delivering that critical care and with the systems that they rely on every day just to make sure that they're reliable, efficient, and also easy to access. Through the forum, what we do is we identify any trends that come through, we surface any pain points, and then we work with the right teams to drive that meaningful change. We also celebrate the teams who are consistently delivering that great service by recognising our monthly feedback superstars. Continuous improvement isn't just about correcting, it's also about really reinforcing what's working well.
Excellent. Yeah, I couldn't agree more that these staff behind the scenes have such a critical impact to the system and, we need to look after them so they can look after the people at the front line. So, Bri, what's a recent example of an improvement that your team has made using this kind of feedback?
So a couple of months ago, we had feedback come through from senior staff members within the Ministry of Health, and that was about delays in ticket handling when it was a major worldwide issue. So what that did was highlight a gap, and now we are able to prioritise and really track certain types of critical requests. And that sparked the development of our new VIP user process. So the goal is to bring in that clearer visibility, faster response times, and also a stronger escalation path to make sure that critical tickets from our senior staff can be prioritised appropriately. So that's just a really great example of what we're doing with the Customer Feedback Forum. We're not just hearing feedback, we're acting on it and we're making improvements because of it.
That's awesome to hear, Bri. When we talk about these service improvements, we often look to the less positive feedback on ideas on what we can do better. But I know that over 90% of the feedback you receive is positive. So what happens with that feedback?
So while we respond to every piece of dissatisfied feedback that comes through, we can't always respond to the positive ones, but it truly is just as important. Our teams take a huge pride in their jobs, and we really love hearing and sharing the feedback with our staff and acknowledging any standout contributions. Danny, you may know this, that sometimes people don't do surveys because they think that people aren't listening or they're not going to get a response back. I just want to let everyone know that we are listening and your feedback really is driving improvements. Really like to encourage you all to, if you ever do get a survey, pop one in. We will respond back to you if there is something that you may not be getting help with or something that you're not happy with. But if it is positive as well, please fill that out because we'd love to celebrate our analysts and our technical people who are doing such a great job.
Thank you, Bri. And you've all heard it here, that commitment to respond to your feedback. Can you share any examples of recent standout or highlight feedback for us?
Of course. So I will just say that we do get 90% positive feedback versus 10% dissatisfied. So positive always outweighs the negative. But one piece of feedback that's really stuck with me lately is where a customer said they couldn't help me straight away, but they kept following up until it was fixed. Every time someone says, I felt heard, or they kept following up, that's a result of our teams thinking with care and also owning the experience. I truly believe that by listening, it's a form of service. And in our health system, where our clinicians are delivering that patient care, we can't afford to treat IT issues like background noise. Our job is to really remove that friction so they can focus on what they do best, and that is saving lives.
I couldn't agree more, Bri, and that's such a good mindset to have and bring to your team. But how do you deal with those challenging situations that come up and motivate your team to work through those with the customer?
All we can do in a high-pressure environment like health really is just to ensure that our people feel heard. That's probably one of the biggest things. They come in to their job with one goal in mind, and as I said before, that's to save a life. The least we can do is make sure that we're listening, and there's always going to be challenging situations in healthcare, especially when it comes down to patient care. As IT professionals, we can't save lives. Obviously, we're not trained to save a life, but we're trained to listen, trained to provide that continuous improvement and really just make sure that the systems are up and running so that they can continue to do what they do best.
I love that, Bri. I think there's a lot to learn from just stopping and listening and trying to understand. But also I think we could all use a bit more kindness in the system and given all the pressure that's on it at the moment.
I agree.
Thank you so much, Bri. It's been so lovely having you to chat all things IT support, feedback and continuous improvement.
Thank you for having me, Danny. I've loved it.
Thanks for listening to Let's Talk eHealth New South Wales. If you enjoyed the show and want to learn more, visit www.ehealth.nsw.gov.au.